Bloodletting is when someone opens your veins and lets your blood drain. Normally they would use a lancet or a sharpened piece of wood. Leeches were commonly used by the rich, and if you were lucky, the leeches would close the wound that was created. A cloth was tied around the arm to make the vein more visible. Veins in the forearm and neck were normally used. Monks and priests were normally the doctors, but then barbers started to offer bloodletting as a service too.
This is a surgical tool called the artificial leech, and what it does is it was invented in 1840 and it was used frequently in eye and ear surgeries. This is an amputation knife that was used for amputations during the 18th century, and they were typically curved because surgeons tended to make circular cuts through the skin and muscle before the bone was cut out with a saw. This is a bullet extractor, and what it did was reach bullets that were embedded deeply into the patient's body. Extractors like this had a screw tip that could be inserted in the wound and lengthened to pierce the bullet so it could be pulled out.
To determine what was wrong with a patient, doctors would focus mostly on the bodily fluids called humors. The four bodily fluids corresponded to elements in the universe such as fire, earth, air, and water. The four humors theory focused on maintaining a balance within the body. Doctors would make a diagnosis depending on what was observed in a person's fluids.
Smallpox is an era-dictated virus that used to be contagious, disfiguring, and often deadly, but there was no treatment. Measles is a viral infection that is serious for younger children. The disease spread through the air by respiratory droplets produced from coughing or sneezing.
A medieval pharmacist either was a doctor or an herbalist. Herbalists would use different plants to come up with concoctions meant for treatments. They would usually prescribe medicines based on the shape of the plant that they were using.
Trepanning is a surgical procedure used in the medievals. This includes drilling of a hole in the human skull. Doctors used this practice in the Middle Ages to treat illnesses like epilepsy, migraines, and a variety of mental disorders. If you were suffering from depression, a little hole to the head was the cure. Unfortunately, the hole to the head also commonly exposed the brain to airborne germs, and it often was fatal.
Surgeons use a painful process called needling to perform cataract surgery. It includes a thick, flat needle that a doctor would push into the edge of a person's cornea with no anesthetics except for maybe a cup of wine. The idea behind this technique was to push the opaque lens back into the lowest part of the eye, which would result in a clear pupil. However, the alien patient was technically left with an unfocused eye. The amount of vision would only allow a person to read the huge letters found in modern eye tests.